Friends, I'm honored to present Side Effects, a new project from the National Credit Union Foundation about the financial crisis of cancer in America and how credit unions can best serve the members who are battling this terrible disease.
Side Effects began as a conversation between Gigi and me around her dining room table in February of 2020. She wanted to build on the Foundation's research into how credit unions and healthcare can work together to improve the lives of our members, especially those suffering from cancer. From that discussion was born this ambitious 7-part documentary series, a collection of films, essays, photos, and audio episodes that I was honored to create, each crafted to help credit unions solve a problem that's going to affect nearly all of our members in one way or another.
While this may be a hard issue to tackle, especially while still coping with COVID-19, we believe those COVID-19 health and economic challenges mirror the struggles faced by cancer patients and their families every single day. We hope that the lessons our movement has learned during the pandemic may help us show our members that we are on their side in their fight against cancer.
Thank you for watching, listening to, and sharing these stories. Welcome to Side Effects.
We say the financial crisis of cancer, financial toxicity, is this massive issue that's hiding in plain sight. Family Reach partners with hospitals across the country, and we work with their oncology social workers who let us know about a family that's in trouble. Either they're not making it to treatment, they're not filling their prescription, or the patient has come to the social worker and said, I'm about to get evicted, or my car is going to be repossessed. They come to us so late because they have put off this conversation for so long. And they've put it off because of fear. They're afraid they won't get the treatment that other cancer patients are getting. They're afraid their doctor might not tell them about a trial or give them a certain scan or a certain med, so they're afraid. People don't talk about their finances. And people don't talk about their finances, especially when there's cancer. You're supposed to be focused on the cancer. Hospitals aren't talking about it because they're focused on the cancer. So this reality, this side effect of cancer is there, but people don't talk about it until it's too late. Many of the middle class doing fine financially, when cancer strikes and their finances are deeply affected, we see that those basic needs, those basic human needs, housing, food, shelter, transportation, heat, utilities, are the last to be paid because you're going to cover your medical bills to make sure that you can beat cancer.
Financial toxicity is any harm that a patient experiences as a result of treatment or as a result of their disease or their cancer in this case, in my case. And I think that term financial toxicity is particularly important because it frames this particular harm in the same way that we would think about physical toxicity. So it's very easy to think about the physical toxicity of cancer treatment. It can cause fatigue or nausea. Financial toxicity can cause similar harms in patients, and so that phrasing is particularly important to me. Patients with cancer, from the day they are diagnosed to 30 days out, the vast majority of those patients hit their out-of-pocket maximums, which means they're immediately facing thousands of dollars in medical debt. If that diagnosis happens in December and continues on into the next year, well, that debt immediately doubles because your out-of-pocket maximum resets. I think that's an important awareness for the financial industry to have, that even if a patient is insured, they could immediately be thousands of dollars in medical debt.
73% of cancer patients deal with financial toxicity. Cancer patients are 2.65 times more likely to file for bankruptcy, and those that do have a 79% higher mortality rate. So this is a part of cancer that can't be ignored.
More often than not, the greatest satisfaction that a patient gets from the insurance company or maybe their financial institution is an acknowledgement of what they're going through. It's a really small step that makes a huge difference in the life of a patient. It starts a conversation.
We always say that the hospital is where you're treated, but the home is where you heal. And we have to make sure cancer patients, A, have a home to go back to, but that it has heat and that there's food and transportation to get back to the hospital. We've piloted a program with mortgage companies because the number one bill that I pay is housing. It's the biggest non-medical bill for cancer patients, and it's the biggest threat to lose your house as a loved one is battling cancer, and that's what we see every day. So 70% of our financial support goes to housing. So we piloted a program where we were working with banks to see if we could modify loans or extend payments. We just bumped into one wall after another.
I've talked to people all around the world about this concept of financial toxicity. And in the vast majority of cases, people from other countries are aghast that somebody could go bankrupt because of a cancer diagnosis. And we know that patients who get a cancer diagnosis are at significantly higher risk of filing for personal bankruptcy. That's not to say that in other countries, patients don't experience some form of financial toxicity. It can happen because there are other countries where patients still have out-of-pocket expenses. But the experience of financial toxicity here in the US is unique. And it is an artifact of our healthcare system, our healthcare delivery system, and our healthcare pricing system, and our health insurance system.
In this world of COVID-19, the world has come to this sort of realization and this deep understanding of what a health crisis followed by a financial crisis looks like. Because with COVID, there is fear of getting sick. Cancer patients live with that. They're immune compromised. There's job loss. There's housing insecurities, food insecurities, isolation. That's cancer. So that's the health side when you talk about a health crisis, followed by a financial crisis. We work in the healthcare industry, but the money that we pay and the support we give to patients goes to the financial industry. The financial industry can play such an important role in the cancer patient's journey, and they might not have drawn the line to healthcare, finances, and health before COVID-19. But I am hoping that this was sort of an awakening so that people realize that finances play a direct role in somebody's healthcare.